Hi everyone, welcome to today's episode on Eat, Live and Be Well. Today we are going to be talking about arthritis, and my name is Dr. Dennis Nturibi, and this is Eat, Live and Be Well. Now, generally speaking, arthritis is a word that means joint pain or joint inflammation. And pain and inflammation commonly go together. From the medical perspective, I'm going to class arthritis into two broad categories, okay? So we have osteoarthritis and we have rheumatoid arthritis. Now, osteoarthritis basically means arthritis of the bone, because osteo is the Latin word for bone. And osteoarthritis comes about because of bone wear or bone degeneration. I'll give you a simple example. Now, if today you fracture your joint, okay, you're going to have pain. Now, I could say you're having arthritis. That is true. You're having pain of the joint, okay? However, the cause is a bone fracture. Now, this can be treated, and after about 6 weeks, you're going to feel better and you'll be fine. Now, as the years go by, if the fracture involved the joint, this particular joint might age a bit faster than this joint because of the trauma that it suffered, okay? And that kind of aging causes some wearing and degeneration. And as you can see in the attached photo, you can see what a normal knee joint looks like and what an advanced osteoarthritic knee joint looks like. So going by this example, as one gets older, if they had such an injury, this particular joint might start to hurt earlier than this particular joint because the degeneration following that injury has started earlier in this joint. Now, with today's lifestyle, a lot of us are going into joint pain and inflammation at a fairly young age. I think most of us can remember a grandparent or two having that kind of thing, probably at an advanced age. However, these days we are seeing it coming to people even at as early as in the 40s. And this is primarily a lifestyle mediated issue. Now let me explain. One of the earliest joints we see with osteoarthritis is the knee joint, okay? And look at my fingers. Assume this is your body and those are your knees, okay? Assume those are your knee joints. Now, if your frame is made for carrying 70 kilos, and due to various factors, we could even say you're carrying a backpack. We give you a backpack with 20 kilos, which you're supposed to carry every single day, okay, and go to bed with. So if you're 90 kilos and your frame is made for a maximum of 70, it means that you are walking around like with a backpack on your back of 20 kilos, okay? And your body's joints are not made for 90 kilos. So that whereas your joints would have served you for say 70 years or 80 years, you find that your joints are now serving you for about 2/3 of that time as a consequence of being overworked or carrying this extra weight. And that is one of the earliest features of osteoarthritis we are seeing in fairly young people. Knee joints and knee pains as a consequence of early degeneration. Then, on the other hand, these are the same people who are probably not eating foods that promote healing and recovery, and also engaging in habits and eating foods that promote body degeneration, okay? And then, unsurprisingly, they're going to develop osteoarthritis, and not just of the knees, but of a number of other joints. Now, if you're currently using the BMI as a basic guideline, if you're currently overweight, you are at risk, overweight or obese, you're at increased risk of early joint sort of fatigue. Let me call it fatigue, okay? On the other hand, if you're already having knee pains, okay, and these are the kind of knee pains you have as you walk about, most people will say the pain is worst when going down the stairs, not going up, when going down the stairs. Because when you go down the stairs, your joint is taking more weight as you come from a higher position to a lower position. Please make arrangements to see your doctor so that you can be guided on what needs to be done in terms of treatment. It's also a sad reality that a lot of people with hip osteoarthritis. So what happens with osteoarthritis is the knee starts and the degeneration starts slowly, whether it's at the knee or the hip joint. But with time, it progresses. And in the early phases, or to a certain extent, your body is able to repair the damage that has occurred. However, beyond a certain point, repair becomes something difficult for your body to implement. And this then leads to advanced and almost permanent joint degeneration. And ultimately, especially for young people, and young is anyone below the age of 65, if you're having a hip joint that has a lot of pain, you're not going to be able to get about your usual activities, you're not going to be able to walk comfortably, you'll be forced to spend a lot of time seated, which also contributes to you getting bigger and bigger, which worsens the knee joint. So it becomes a very vicious cycle. So in modern medicine, we have what is called knee or hip replacement surgery. And maybe another day I'll talk about that in more detail. But once you get an artificial hip or knee, then that allows you to get back to movement sooner rather than later. However, of course, these conditions are best prevented, not necessarily best treated. It is expensive to get these procedures. These joints have a lifespan, they're not going to live in you forever. So typically, I think as a standard, many of them will be changed anything between 9 and 15 years. And there are the risks of surgery and all these things. Now, we're having a number of patients who are not able to go for the hip replacement or knee replacement surgery because they are so unhealthy that even the doctors are afraid to put them under general anesthesia for surgery, because they might not make it up or they might not wake up after the surgery. So it gets complicated, and ultimately what you do want to do is avoid them. Then we have a less common known type of arthritis called rheumatoid arthritis. Rheumatoid arthritis is the one that affects, you've seen it affect older people where they get bent and knuckled hands and they're not able to move very well. And typically what happens is when they wake up in the morning, their fingers and toes are stiff and painful. But by 10 o'clock, 11 a.m., they're feeling a bit better. When it gets warm and sunny, the joints ease out. We typically call that rheumatoid arthritis, and we believe it has an immune component. Okay, so there's some certain aspect of the body's immunity attacking the joints, and that causes a problem. What has been very interesting is that more and more research is pointing to a lifestyle factor as well, which means if there were two versions of me, exactly the same, and also having some genetic tendency to rheumatoid arthritis, then this version lives a healthy lifestyle, this version lives a not so healthy lifestyle. Version B here, not living a so healthy lifestyle, is going to develop rheumatoid arthritis earlier than version A. Then version B is going to have more severe symptoms and is going to progress faster. Okay? So we're having a correlation for a number of medical conditions where we say the genes load the gun. So you have the genes, they came from your parents, there's nothing you can do about that. The gun is loaded. However, lifestyle pulls the trigger. And we all know a loaded gun and a gun that has been shot are two different things. They are both guns, but the consequences can be very dramatically different. Therefore, good people, arthritis does not have to be your lot as you get older. Okay, that is not true. You can live a lifestyle that promotes good health, and things like arthritis can be kept at bay. Ultimately, all of us, if we live long enough, our joints are going to get old, just like our skin gets old. That is not a bad thing, that is a course of nature. But the journey between now and that point does not need to be miserable. Here at Eat, Live and Be Well, we are working to educate you on these things so that we can put the power of pursuing good health back in your hands. Okay, not necessarily in the hands of your doctor, and certainly we want to eradicate a lot of the confusion that is already prevalent. So please feel free, reach out to us, give us a phone call, drop us an email, subscribe to this channel, continue following our discussions, and hopefully you shall get more and more knowledgeable as we continue on this journey. My name is Dr. Dennis Nturibi, and this is Eat, Live and Be Well.